Coronavirus case numbers are climbing around the world. Right now, the U.S. is averaging more than 130,000 new infections and 1,200 deaths every day. Delta remains the dominant variant in the U.S., but Omicron has spread to at least 45 states. Cases of the new strain double every 1.5 to 3 days. Some good news. Moderna says its booster shot offers strong protection against Omicron. The company's half-dose booster raises antibody levels 37-fold, but only about 30% of vaccinated Americans have a booster shot. Meanwhile, lines for COVID-19 testing are out the door. Demand is rising for PCR, rapid tests, and at-home kits. An urgent care provider in New York City says its testing volume increased more than 25% over the last 2 weeks, delaying the time it takes to get lab results. All this during one of the busiest travel times of the year. The TSA has screened more than 2 million people per day for the last 4 days. That is almost as many travelers as the holidays in 2019 before the pandemic. Now, the U.S. Surgeon General has a warning for unvaccinated people as Omicron spreads.
In coming weeks, Tony, we are going to see a spike in cases, and that's because Omicron is incredibly transmissible, and we have to be prepared for that. But there will be a stark difference between the experience of those who are vaccinated and boosted versus those who are unvaccinated. With those who have maximal protection from a vaccination and a boost, you either won't get infected, or if you do get an infection, it will be most likely mild. But if you're unvaccinated, I'm worried about you. I'm worried that your risk of being hospitalized or, God forbid, losing your life to this virus is quite significant.
I want to bring in Dr. Stanley Perlman now. He's a professor of microbiology and immunology at the University of Iowa and a pediatric infectious diseases physician. Dr. Perlman, welcome. Let's start with the Moderna news. So a half dose increased antibodies 37-fold and a full dose increased antibodies 83-fold. However, the company is not seeking authorization for the full booster dose. Why is that?
Well, because in most studies, the 50 microgram dose is pretty equivalent to the 100 microgram dose, and a factor of 2 is not a huge difference. It is a difference, so I don't want to minimize it. And I think that putting together all the issues of safety plus efficacy, the decision was made to go with 50 micrograms. In the original studies, 50 microgram was pretty equivalent to the 100 microgram dose, and the Pfizer dose, remember, is only 30 micrograms. So I think those are the bases for the decision. Plus, we want to make sure that it's safe, and maybe using less for a booster would increase that. Really no evidence for that, but that's part of the thinking.
So are the trials bearing out that the Moderna booster is more effective against the Omicron than the Pfizer, or is that not quite what this data says?
I don't think we can say that yet, because the two are usually not compared side by side. I think what the data say is that they're both more effective against the Omicron than other vaccines. And that's important because the Omicron is evasive enough, so it's avoiding most of the response against the initial vaccination strategies.
Right. So let's get to that because, of course, Omicron is spreading quickly in the United States. The early data suggesting it is more transmissible, but perhaps less severe than the Delta variant. Is that correct, or is it still too early to know about that?
I think it's a little too early to know. I think even the transmission data is a little too early, though more and more data is showing that, in fact, it is more transmissible. In terms of clinical disease and severity, I think we still have an open question because so much of the initial spread was among populations that were a little more resistant, young people who tend to get less severe disease. So I think we don't know for sure. Certainly the signs are not pointing towards more severe disease, which is good. But we need to wait and see. And of course, our hope is that this will be true and that disease will be less severe in people who are infected with Omicron.
Now, what about among those who are unvaccinated? Because, of course, 40% of Americans are still unvaccinated.
Yeah, this is the concern. So even if the virus is a little less virulent in this population, if a huge number of people who are unvaccinated become infected, they may still have a substantial number of people who develop severe disease, which would be bad not only for those individuals potentially, but also for healthcare systems. So if the rate of people getting really sick was twofold less, but 4 times as many people were infected, clearly one can see that there'd be more people who are really sick. So
Right, so
I think that's what we think.
does it start to become a numbers game at a certain point? So in other words, the more that it spreads, the more people who get infected, there's going to simply be a larger percentage of people who will get very sick.
Yeah, I think it's a very fair thing to say. Certainly the studies in Israel showed that in the hospital, there are people who are vaccinated and unvaccinated. This is during the Delta variant. But there were equivalent numbers, but then it turned out there were 9 times, for every person, there was 9 times as many people vaccinated as not vaccinated in the country. So it comes out with the unvaccinated people still bearing the vast part of the infectious burden.
And as an immunologist, when you look at the way this variant is spreading, what are your biggest concerns with also how the virus keeps mutating?
Yeah, so taking the latter part first, the latter part of your question first, I think it's really unclear how this virus is mutating. It has so many mutations compared to the previous variants, and we know that viruses take a bit of time to mutate. So people have guessed, and no one really knows. People have guessed that this mutation occurred in a person who doesn't have a very good immune system, or it occurred in animals that were living near people, and then the virus went back to people. But there's really no understanding of where it comes from. And it's so important because if we're going to stop the pandemic, we want to be able to stop variants like this arising. And so, some of these changes don't even arise in relation to the immune system. They just are part of the viruses evolving to do what it wants to do, which is transmit to more people. That's really its key goal.
Right.
Higher transmission rates.
And Doctor, the U.S. has relied on a lot of international data during the pandemic from countries like the U.K. and Israel. I mean, they say that the U.K. does a lot better job of sequencing, the infections. Does the U.S. need to improve its public health data? Is this impacting our ability to get ahead of the virus?
Oh, for certain. From the very beginning of the pandemic, we didn't know how much virus was spreading in the country because we didn't do enough testing and we didn't do enough sequencing. We're getting better, but this is clearly a problem because in other countries, like the ones you mentioned, one can learn much more quickly how the virus is spreading, who's getting infected. Here, it takes much longer. So absolutely, that's the way one would stop spread, is knowing what's out there.
It's important to learn as much as we can about this virus. Dr. Stanley Perlman, thank you so much for joining us. We appreciate it.
My pleasure. Thank you for having me.